So when we think about the current risk assessment models, a lot of them have been developed that focus just on standard risk factors. Some integrate breast density. Some also integrate genetic, like whether somebody carries a mutation or pathogenic variant in a high penetrance gene. And then there's these novel polygenic risk scores. So, when we're seeing somebody and we're trying to assess somebody's risk for developing cancer, all of these things are important. And so one of the models, or the model that Dr. Antonio presented, really looked at integrating all of these models and trying to therefore be able to produce a more accurate and comprehensive risk assessment for an individual. Now, one of the limitations to all of our models and much of what we do in medicine, unfortunately, is that they also tend to be weighted more towards the population in which these models were developed, which are typically of European descent. And so these models are now starting to incorporate other ancestry-related risks so that, again, we can be more precise. There is a lot that needs to be developed still within these risk models: education of providers, education of patients, the importance of understanding what the risk means, as well as having a more tailored approach to potentially cancer screening or prevention. So I think we still have a ways to go with this, and we need to make sure that we are providing and figuring out how to have people fully understand the results of this, because it can be scary to get something that says that one has an X-fold increased risk. And so I think, again, they need to be further developed, and also the big part as well has to do with education, with how to manage or what to do with this risk model.